Hey, GLP-1 plus sides community. Before we jump into the podcast, please take the time to leave us a 5-star review on whatever audio platform you're listening to the podcast on. Share your story and how the podcast has helped you. This will help us get referred up in the audio platform so that we can reach more people that need our help, our support, and guidance from our doctors. Help us get loud and change things.
Are you interested in understanding GLP-1 medications like Ozempic, wegovy, or Mounjaro? Then join us on the Plus Sides Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.
Hey everyone, before we dive in, I really want to share something personal with you. About, I want to say like 8 to 10 months ago, after losing 100 pounds on GLP-1s and keeping it off for a long time, I started regaining out of nowhere, and I was terrified. But I also started having hot flashes and bouts of crying and snacky cravings and waking up at 3 a.m. unable to go back to sleep. It turns out I was in perimenopause. So I started hormone replacement therapy, which is also called HRT, through a telehealth called Winona that specializes in this. And it changed everything. And now I'm sleeping better. And my hot flashes are all but gone, thank God. And I feel like myself again. And it turns out that you can actually start perimenopause as early as 35. And well, I'm 46 and she's here. HRT has really come a long way, and there's just no need to suffer anymore. So if you're like this and you're in the same boat, you can check out buywinona.com and you can use the link in our link tree to save some money.
Want the fastest working GLP-1? For half the price, Ro now offers FDA-approved weight loss injections cheaper, with results you can see faster. Lose 15% of your weight with the formula from Eli Lilly that hits not one, but 2 hormones to curb hunger and nausea. Weight loss faster, confidence higher, price cheaper. See if you qualify at ro.co/TV.
Hello, how are you?
What's up?
I'm fine. Thank you for having me back. I guess you didn't learn your lesson the first time.
I guess not. Clearly.
Look, no.
Or maybe I did learn it and I just want you to come school everybody again, you know? This is Mad Endo on TikTok, also known as Dr. Melissa Young, who has come to hang out with us. She's an endocrinologist and knows a lot about the disease of obesity, PCOS, all the things. And we're going to talk about all that today. And I'm just so glad to have you. But for those who don't know you, can you tell us a little bit about you, like what you do and how you help people?
Sure. I am, as Kim said, I'm an endocrinologist. I've been in practice, I'm not sure I want to say how long, for over 20 years. I do general endocrinology. There are some endocrinologists who will specifically just do pituitary or just do thyroid, but I do general endocrinology. So although the majority of my patients do either have diabetes or thyroid disease, but I also see people with other hormonal disorders, low testosterone, pituitary disorders, adrenal, and so on.
Right. Okay.
I don't specifically treat weight loss or treat obesity as a separate thing, but many of my patients, they come in and when I ask them, have you been since last time? One of their first complaints is, well, I gained more weight. we kind of end up on that path many times.
What I'm noticing is that a lot of times people are like, what kind of doctor do I go to for these medications? And in my research and, experience thus far, it seems like to me that these medications are complicated and they're not always easy to dose. And the disease of obesity and all these related disorders are very complicated as well. So sometimes you can't always get care from a GP where they may know about these things to properly like handle, your care on this journey, which is long, and so and you can tell me what you think, but it seems like bariatric doctors, endocrinologists, and obesity specialists seem to understand them best. And so I would like to know a little bit about like, what is an endocrinologist? Like what are you actually looking for like in the body? What is your like expertise in that area? So we can understand what that means.
So endocrinology is the branch of medicine that deals with hormones. And a hormone is, most of the time when people think of hormones, they only think of estrogen and testosterone. But a hormone is a substance that's made by a tissue in the body that travels through the bloodstream and affects other organs. So, as opposed to, say, a salivary gland. The salivary gland, there's a duct and the saliva goes into the mouth. And so that's not a hormone. But insulin is secreted by the pancreas. It goes through the bloodstream and it affects many organs. And so that is considered a hormone. So we treat it, again, in general endocrinology, we treat many different hormonal disorders. There are, sometimes people ask me for me to check, quote unquote, all their hormones. And I said, I can't do that because there's hundreds. And so when we check hormones, we need to know which one we're checking and why, because there are, depending on what the symptoms are, there are different things we're going to look for.
Yeah, that makes total sense. In terms of like the endocrine system, how is that connected to things like preventing stroke or heart disease and things like that?
So that's kind of a complicated question because because hormones affect a lot of different organs in the body. Yeah. So there are many endocrine disorders that can have an impact on atherosclerosis. Primarily, just from a number standpoint, a prevalence standpoint, diabetes is going to be a very high risk factor. It's actually considered a heart disease equivalent because people who have type 2 diabetes are at very high risk of developing atherosclerosis, blockage of the arteries, and so that increases the risk of heart attack and stroke. But there are other, endocrine disorders that increase that risk as well. And just having the disease of obesity, because it, and people don't think of obesity as a hormonal disorder, but it is, because again, we're talking about, the hunger and the satiety hormones, ghrelin and leptin and so on. Mm-hmm. And when the fat cells, when the adipose cells fill with lipids, with fat, they secrete these pro-inflammatory substances, and that increases also the risk of developing atherosclerosis. And again, it's that blockage of the arteries that increases the risk of heart attack and stroke.
I know recently you had talked about Novo Nordisk, and I remember seeing a TikTok about it where you were talking about like how it has like helped with, well, it was like a study, and it was a big study. I think I remember. And you were talking,
trial?
Yeah, where they were specifically.
So the SELECT trial looking at semaglutide 2.4 milligrams, so wegovy at the highest dose. Yeah. There's, I think, 17,000 people in the study, and it was placebo controlled, which means that a certain number of people were on wegovy, and a certain number of people were not. They were on placebo. And when they looked at, and these are people who had known heart disease, when they looked at the incidence of what's called MACE, major adverse cardiovascular event, so that's death due to cardiovascular disease, heart attack, and stroke, the people who were on semaglutide had a 20% decrease in their risk. So, and when you look at weight loss by other means, people who diet and exercise and able to lose weight, or even looking at bariatric surgery, there is a decrease in MACE, but not 20%. So there's something else that this drug does that decreases the risk of cardiovascular events.
And then isn't there GLP?
We had that data with Ozempic already. years ago.
Yeah.
We already knew that, and that's at a lower dose. I think that like a
Yeah.
26% decrease or something in the study that they did for that. So this is not a surprise at all.
How can years of yo-yo dieting affect your endocrine system? Impact,
Ooh.
effects, things like that.
Mm.
Because
Well,
that's
Good
where we're all here for that.
also, when someone gains weight, again, there is an impact on those hunger and satiety hormones. And so people who are overweight or who have obesity, when they feel like their body's fighting against them, when they try to lose weight, they're not imagining that. That is true. They are
Yeah.
hungrier. It takes more food to make them feel full. And this is, particularly true also in people who have type 2 diabetes because of the insulin resistance. And when people have insulin resistance, when they have type 2 diabetes, the other hormones that are affected is GLP-1, the incretins. So the body becomes resistant to GLP-1. And so GLP-1 is supposed to help you make more insulin when your blood sugars are high, and help with satiety, but their body doesn't respond to the amount that their body is making. And of course, there's a decrease in insulin, there's an increase in glucagon, which leads to the abnormalities in glucose. So there are many hormones that are affected by weight gain. And then when you try to lose weight, again, there's this dysregulation in the hunger hormones, which makes you feel the need to eat more. So when people are faulted for their lack of willpower, it's a brain thing. It's a hormonal thing. It's not that intellectually, these people know that they shouldn't eat as much. But they have this need to do so. Their brain is telling them that they need to eat.
What truth was it to those infomercial pills that said they would reduce your cortisol and your belly would shrink? If there was truth at all.
If there was truth, then we wouldn't need wegovy. While it is true that excess cortisol causes weight gain, the amount of cortisol that you can make physiologically, unless there's something actually physically wrong with your adrenal gland or with your pituitary gland telling your adrenal gland to work harder, you just can't make enough cortisol to be the sole cause of the weight gain. Having said that, there are some physiologic things that happen. So people who are shift workers, people who have to work at night, because their daily normal cycle of cortisol production is thrown off, they do have a harder time losing weight. People who have sleep apnea, again, because they think they're sleeping, but their brain keeps waking up because it's trying to keep them breathing. Yeah. Again, their baseline cortisol levels are higher, so they also have a harder time losing weight, which is a vicious cycle because the weight gain increases the risk of sleep apnea. The sleep apnea makes them gain more weight, and so on.
Yeah.
But these pills that are available that allegedly lower your cortisol, no.
No.
The short answer is
Sugar
no.
pills. Oh, wow. See, don't buy that stuff off infomercials.
Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m. and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again. And the hot flashes are gone, which is really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through the same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need. Today's episode is brought to you by Ro, a telehealth platform that's changing the game of GLP-1 access. What sets Ro apart? Ro understands the challenges of navigating insurance hurdles and the skyrocketing prices of GLP-1 medications. That's why they specialize in getting insurance approvals for GLP-1s. And if insurance is a barrier, they go a step further by prescribing brand name zepbound vials for prices close to those of compound GLP-1s. With Ro, you're not just getting a prescription, you're getting a partner in your journey that's helping you access affordable treatment and guiding you every step of the way. Whether it's insurance approvals or cost-effective alternatives, Ro is here to make sure that you get the medication you need. Visit ro.co/plussides with a Z today to see how they can help you take control of your weight management journey with affordable, accessible care. That's ro.co/plussides with a Z, making healthcare work for you. Check out the link in our show notes for more details.
Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.